Hey guys, it's Michelle. Welcome back to another video. So in the video today, I'm going to share with you 20 commonly used vocabulary when talking about pregnancy. So I've split them into 4 categories. The first category we're going to start out with is general terms related to pregnancy. So the first term in this category is pregnancy, or you can say gestation. But gestation is more of a medical term. But if you say pregnancy, everyone will know what you're talking about. So an example is, congratulations on your pregnancy. Another example is, for example, Nurse Alice may tell the patient's midwife, Megan, to please closely monitor the patient's blood pressure for the rest of her gestation. The second term is delivery date. Delivery date. So for example, Nurse Alice may ask the patient, when is your delivery date? Or she may ask, when are you due? Or when are you expecting the baby? The third term is prenatal vitamins. Prenatal vitamins. An example is, are you taking your prenatal vitamins? Or more specifically, the nurse may ask the patient, are you taking your folic acid supplements? Ultrasound. Ultrasound. So for example, Dr. Williams may tell the patient, we'll perform an ultrasound which will help in identifying fetal and maternal structures. Blood typing, and RH typing, RH typing. So for example, Dr. Chen may tell the patient, we'll perform a blood typing and an RH typing in order to determine your blood type and to determine whether you're RH positive or RH negative. The second category is what the woman may experience during her pregnancy. So the first term is morning sickness. Morning sickness. So even though this term has the word morning inside of it, the thing is that the woman can experience the sensation of nausea and vomiting anytime, day or night. It's not only limited to the morning. So an example is the nurse may ask the patient, have you felt any nausea or any vomiting sensation anytime during your pregnancy? Next is increased vaginal discharge. Increased vaginal discharge. So an example is the nurse may ask the patient, have you noticed an increase in your vaginal discharge during this pregnancy? The third is increased urination. Increased urination. So an example is, have you noticed that you need to urinate more frequently? Breast tenderness. Breast tenderness. Example, have you experienced any breast pain or tenderness? Fetal movement. Fetal movement. Now, the thing with fetal movement is that patients won't actually usually say fetal movement. It's more of a medical term. Instead, patients will usually say, I can feel my baby kicking. And that's how they would express fetal movement. Next, contractions. Contractions. Example is, Nurse Yvonne may ask, have you been experiencing any contractions? How long do they last for? How often do they occur? The third category is healthcare professionals commonly involved in the pregnancy. So the first one we have is family physician. Family physician. Or family doctor. Family doctor. Example is, my family doctor is closely following my pregnancy. Number 2, OBGYN. OBGYN. So OB stands for obstetrician. Obstetrician. GYN stands for gynecologist. Gynecologist. So an example is, my OB will be delivering my baby. Or you can say, my obstetrician will be delivering my baby. Number 3, midwife. Midwife. An example is, my midwife will be helping with my home delivery. Number 4, public health nurse. Public health nurse. Example is, I've gone to see the public health nurse to update my vaccinations so that I can protect myself and my baby. The fourth and final category is the length of the pregnancy. So the first term is gestational age. Gestational age. That means the length of the pregnancy measured in weeks. Now, gestational age is more of a medical term. So for example, Nurse Xiaoyu may tell Dr. Smith the patient's gestational age is 37 weeks. Next is trimester. Trimester. So that is the length of the pregnancy measured in months. So for example, we have first trimester, second trimester, and third trimester. So the patient can say, I'm in my second trimester, or I'm in my third trimester, or I'm in my first trimester. Next is full term, preterm, and finally, late term. So how those terms may be used is Nurse Yue Yang may tell Dr. Li, the patient previously had 2 full-term pregnancies, or the patient previously had 2 preterm pregnancies, or the patient previously had 2 late-term pregnancies. All right, that's all for today. Thank you so much for watching. Hopefully that was helpful. And if you found this video helpful, please give it a thumbs up, and I'll see you in my next video. Thanks so much. Bye.